Gavin, you want me to start talking or what?
We'll just give it a minute here to
Okay.
fill in, and then I typically give it a couple minutes.
Sure.
Then we'll get going. Okay, I think we'll get started here. I would like to thank everyone for joining the webinar tonight. The topic is beating the blues. Just a little bit about Northern Hearts. We're a Thunder Bay-based charity whose mission it is to reduce the incidence of cardiovascular and heart disease in Northwestern Ontario. For tonight's presentation, we're going to be recording it, and if you'd like to view a playback, it'll be available on a link through our website, which is www.northernhearts.org. Tonight's presenter is Dr. Mario Nucci. He, just a little bio, received his MD from the University of Calgary and his residency in family medicine from Queen's University. He practices primarily in hospital medicine, mental health, and addictions. And on behalf of Northern Hearts, we would genuinely like to thank Dr. Nucci for putting this on this evening. So I will pass it off to you, Dr. Nucci.
Thank you, Gavin, and I'm very excited to be here. I'm hoping that I can share something useful and interesting for the attendance today. As Gavin said, I have a large part of my practice in mental health, and I'm a mental health advocate for patients, people in the community. And so I was excited when I was asked to speak about this particular topic. They wanted me to speak about the winter blues, and so we're now hopefully getting into spring. I mean, today was a nice day. I mean, winter certainly has dragged out. The groundhog, whoever said that we were getting an early spring, wasn't doing a good job. And so hopefully we get some good weather. But I'll talk about the winter blues, what it is, how we can treat it, and these principles apply broadly to the blues or depression in general. So I'm just going to advance the slide here. So just some disclosures. I don't receive any endorsements. I'm merely here to inform and educate, but this isn't personal medical advice, and just to consult your own physician before initiating a medical treatment. So I want to talk about depression and seasonal mood symptoms and things like lifestyle, behavioral, and cognitive approaches, and how we can make people feel better from these conditions. So, what is the winter blues? In psychiatry, in mental health care, the sort of Bible of diagnosis is this thing called the DSM, and they're very specific about how do you make a diagnosis of these things. And for major depressive disorder or depression, what is known commonly and publicly, the definition is 2 or more weeks consecutively of this list of symptoms, but you have to have one of low mood and decreased interest. And the other symptoms include decreased energy, change in appetite, concentration issues, physical agitation or slowing, feelings of guilt, sleep changes, and suicidal thoughts. And seasonal affective disorder is basically a major depressive disorder with a seasonal pattern, or a bipolar depressive disorder. It classically has a seasonal onset and remission. For example, it goes away in the spring or the summer, and it's present for the past 2 years, and there are no non-seasonal episodes, or at least the seasonal outweighs the non-seasonal episodes. Certainly, you can have symptoms of seasonal mood changes that don't meet the full criteria for seasonal affective disorder. And we would call that a subsyndromal seasonal affective disorder. So in other words, you have symptoms, but they just don't qualify for the full diagnosis. With seasonal affective disorder, some of the more common things we would see would be, for example, an increased appetite, especially for carbohydrates, some weight gain, some more sleep, for example, 1 or more hours than in the summer months. So, you know, clinicians, someone like myself might ask patients some questions to figure out if seasonal mood symptoms are a particular issue for them. And some of the questions might be, you know, do you feel worse or sad in the winter? Do you eat more in the winter? Do you gain weight in the winter? Do you sleep more in the winter? Do you have less energy in the winter? Do you socialize with other people less often? Does sunny weather improve your depression? Do you get better when traveling to a sunnier location or with more sunshine during the day? Does your depression go away in the spring or summer? As you might expect, seasonal mood symptoms certainly vary by latitude, and that has a lot to do with the amount of sunshine. So, for example, 1% of people in Florida might have seasonal depressive disorder, but 10% in, say, northern Finland would be the prevalence. And again, it depends on the sample. And subsyndromal seasonal affective disorder, you know, could be up to an additional 14%, depending on which population is sampled. Interestingly, of patients with depression, 15% or so have a seasonal variant, and recurrent seasonal depression does persist in less than 50% of patients. So, you know, this goes back to sort of the lifestyle approaches to health, which Northern Heart certainly has a large affinity for, and, you know, lifestyle approaches to mental health. Light is incredibly important for mental health and well-being, and even physical health and well-being, and I will elaborate on that. The evidence shows that decreased light exposure is a big factor in why seasonal mood symptoms happen in some people. People with true seasonal affective disorder or seasonal depression, they may actually have more sensitivity to light. What happens when we wake up in the morning is light hits the back of our eye and suppresses melatonin that's produced when we go to sleep at night. And if you don't have that natural light from bright light from sunshine, you don't have that melatonin suppression. And so you may get actually some sleep cycle disruption from having the melatonin hang around a little bit more. And there's also some evidence with specifically with the brain itself and the stimulation of light hitting a particular mood center in the brain. You know, and it's thought that actually the seasonal mood variation is almost like a hibernation-like response. People feel lethargic, they feel less social, they want to sleep more, they're more tired, they generally move less. So very interesting comparison to our other mammalian cousins, like the bears. And I just shared this slide here. It's a more technical slide from a medical journal paper, but there's a particular part of the brain called the perihabenular nucleus that we have light receptors at the back of our eye that they have nothing to do with vision and visual processing. It's strictly to detect brightness. And those areas of the brain kind of regulate two things. One is our circadian rhythm. So, the time to, go to bed or to be awake, and also mood centers. So the two different areas that the light is affecting in the brain, and the folks with seasonal mood symptoms may be a bit more sensitive in that way. But it basically just shows that we're wired to require sunshine. So again, I've thrown a lot of technical things, parts of the brain, diagnostic criteria for certain conditions, the importance of light. And so what do we make of this? Well, maybe we kind of move to Florida and that'll solve all our problems. But that certainly isn't a reality for most, including myself. And so I'd like to just talk a little bit about some things we can do to improve our mood and our functioning with the wintertime. And these treatments also work for non-seasonal depression as well, for major depressive disorder. So briefly, I'll list them and then I'll go into some details. So bright light therapy, medication, cognitive behavioral therapy, and the lifestyle package that I tell all my patients about when it comes to mental and physical health, exercise, sleep hygiene, socialization, and combinations are likely better than either alone. So lifestyle medicine, and this is not just for depression. In the mental health literature, there's a term called behavioral activation. And what that means is, getting out and doing stuff, for a lack of a more technical term. And the brain has this sort of a bidirectional feedback process. So when you are not feeling good, your brain wants to not do a lot of things, wants to reinforce the current state of its mood. But if you get out and do things anyway, your mood will actually follow along, or it tends to in most people. And so that's called behavioral activation, and it's a core pillar of treatment for mental health, and particularly depression. The next piece is exercise, physical activity, socialization, incredibly important for mental well-being and even physical well-being, and sun exposure, like we talked about. And I'll go into some details about some of these. So for behavioral activation, we talked about sort of that feedback loop that exists where our brain will want to be inactive and isolating, and that leads to lack of pleasure and interest, and which leads to more inactivity and isolation. And how we act influences how we feel. So if we get up and do things, and you can include some of these other important pieces of lifestyle factors like exercise, socialization, having a routine, right? So for some people that might mean, hey, I want to sleep in, but you know what? If I get up, start doing something, have a routine, even if it's just getting up, brushing my teeth, making my bed, you'll turn on that energizer inside. So when it comes to exercise, aerobic exercise seems to have the most research, but strength training is good too. There is definitely more research on major depressive disorder and subsyndromal seasonal affective disorder. But again, exercise is a staple for mental and physical health, and it certainly should be part of a treatment plan. I mention it to all my patients. An easy way to accomplish a lot of the things that we talked about when it comes to getting out and doing stuff, socialization, sun exposure, and exercise is walking outside in the daylight, preferably with friends. Talking about light and how light affects us, there's some descriptions about light intensity. So when we sit inside, you can see that this measurement called lux, or measurement of light intensity, is a lot less than on a bright sunny day. So indoor home lighting might be 250 lux versus a sunny day can get up to 10,000 lux. So there's just orders of magnitude higher light intensity on a sunny day outside versus being inside. And you can even see that a cloudy day is much brighter than indoor home or indoor office lighting. And people do note that their mood symptoms can even be worse on a cloudy day. So this leads us into a simple yet effective solution for seasonal mood symptoms, and that's something called bright light therapy. So they've developed these lamps that have a light intensity of about 10,000 lux. That seems to be the magic number for the amount of light intensity that is needed to appropriately stimulate and to reduce the seasonal mood symptoms. And 30 minutes minimum, 30 minutes to about an hour, ideally in the morning or at latest midday, for a few weeks, and to continue at least a few weeks after someone would have a normal seasonal remission. So if somebody, say for example, tends to get their seasonal mood symptoms go away in, say, April or May, you'd want to continue for about 2 weeks after that with the bright light, just so that there's overlap from the natural sunshine. And if cloudy days bother someone, they can certainly supplement with the bright light on cloudy days. The very interesting thing is that the bright light tends to be, or it is actually in several studies, effective for non-seasonal depression. And again, it just goes to the fact that bright light can be a powerful positive mood stimulator, and is really a core to our physiology as human beings. These tools, bright light, can be useful for people with shift work and who get jet lag. So shift workers and people who experience jet lag, their brain's circadian rhythm is anchored to a particular 24-hour pattern. And that has to do with the fact that the brain is producing melatonin at certain times. I mentioned earlier that bright light suppresses that melatonin production, and that's another reason why you don't want to have a screen on before bed or have bright light before bed. And with shift work, suppressing the melatonin production may actually be useful so that we can have more wakefulness during the shifts and have that melatonin produced later on to allow us to have a better sleep and to regulate our sleep-wake cycle better. An honorable mention in the light therapy realm is blue light, and that's because it seems that the light receptors in the eye that then transmit the signals to the brain tend to be more responsive to blue light than other parts of the light spectrum. And so the standard 10,000 lux is a white light, but the blue light seems to be the specific color of the white light that seems to be exerting most of the effects. And so there seems to be some benefit from blue light as well. Just some general points about using a bright light. Avoid looking directly at the light. Ensure your light has a UV filter. Some medications may be photosensitizing, some topical creams, antibiotics, and consult your doctor if you have pre-existing eye issues, although bright light therapy has been shown to be safe on the eyes for those without any pre-existing eye conditions. So psychological therapies and what I call brain reprogramming for my patients is a cornerstone for both non-seasonal depression, and it can be very helpful for seasonal depression and seasonal mood symptoms as well. And it really comes down to changing thoughts and behaviors. This can be specifically challenging thoughts about winter, changing behaviors like social isolation that, as we noted, these behaviors tend to be reinforced. And with cognitive behavioral therapy, relapse rates tend to be better than those even treated with light therapy, or at least comparable. And again, combination of psychotherapy and bright light seems to be better than either alone. Just a brief word on mindfulness, and what is mindfulness, and how is it potentially useful for depression and in mental health? When we can observe our thoughts and observe our ways of being in a non-judgmental way, we can sort of not feed the cycle of those thoughts. And so, a classic example I like to tell someone is, we sort of have two states of being. We can either be sort of in our thoughts, in our thinking, and sort of racing on that wheel and reinforcing those patterns of thought and behavior. But if we can observe them, those thoughts and patterns of being non-judgmentally, we can sort of get off that cycle. And you can even think of, I have the picture here, watching yourself, your thoughts, your experience, like you're watching it on a movie screen as a third party. And you can learn to let go of those things that your mind is holding on to. So just some brief examples of how people can use some of these psychological strategies to retrain their natural patterns of thinking and behaving. These are just a list of ways that we can go about some of that psychological retraining or reprogramming. Questions like, how is this thought serving me? If I keep thinking like this, where will it get me? Has there ever been a time this wasn't true? How would I advise my son or friend with these thoughts? How would my mother or mentor advise me? On a scale of 1 to 10, how true is this? And why is it not a 10? What would it take to change my belief? So really just trying to break down negative ways of thinking and to then reinforce positive ways of thinking and behaving. I'll briefly talk about medications. Medications for seasonal and non-seasonal depression are most commonly the SSRI variety. These are medicines like Prozac, Cipralex. For seasonal mood symptoms, seasonal depression, we continue for 2 weeks following seasonal remission, and then continue it 4 weeks prior to onset, or even continuously. Some patients find that they'll just continue their antidepressant all year round. So a quick summary. Again, if you're having seasonal mood symptoms and it's affecting you, it's affecting your family life, your home life, your relationships with other people, please do talk to your doctor. It's incredibly important. Mental health and well-being is just as important as physical health and well-being, and I certainly encourage anyone to please talk to their doctor and see what kind of a personalized approach can be made for you in helping you feel better. Again, we talked about some ways of improving, and these include bright light therapy. We talked about cognitive behavioral therapy. We talked about the behavioral activation, getting outside, doing things, socialization, exercise, and some practical things like getting outside for a daytime walk, doing that with friends, an exercise class, a mindfulness class, and perhaps seeking out some psychotherapy. So I've gone through the talk, and I'll now open up the floor for any questions.
Thank you very much, Dr. Nucci. I just want to let everyone know that if you do have a question, you can actually place it in the Q&A box. It's located at the bottom of the video panel. and we'll try and get through the questions. Just maybe to start it off, Dr. Nucci, obviously COVID has been incredibly hard on people, and not just those that have been directly affected by it, by catching it, but by those who have had the mental health repercussions. One of the questions I have is just around sort of the younger generation and what to look out for if the sort of signs and symptoms of depression or seasonal depression would be the same as as that one particular slide that you had put up there for people that are like teenagers or even younger, because I know that it's obviously a really tough age to be going through a lot of things, and COVID didn't help. So if you have any thoughts on that, appreciate it.
Yeah, absolutely. And Gavin, no doubt the pandemic's been hard on a lot of people and a lot of demographics, and certainly children have had their share of struggles, and teenagers as well. And so, the one diagnostic slide, really described sort of what we look for as clinicians, and decreased mood, decreased interest are sort of the two main features, right? And you might see that visibly in someone who's normally a more active and engaged person, or they're normally engaging in their activities, and they're just their behaviors change. They're not doing that now, and they used to express more positive emotion. Maybe they're more flat, or they're expressing more negative emotion, right? So those are two of the key features we kind of look for. And then going down the list, right, decreased energy, sleep changes, change in appetite, whether that's eating more, eating less, concentration issues, and that might lead to some functional issues, right, where maybe they're just struggling in school more, more irritability, and feelings of guilt, emotional regulation issues, and even suicidality, which is a real thing. So you can see a lot of these features, and again, I encourage people just to look out for behavioral changes in their friends, families, loved ones, and if you feel like someone might be struggling, try to have a conversation about it, and medical providers are there to try to help. So,
right. Sort of to follow up, and this is a question that came from one of the attendees. Any suggestions on how to approach someone who you sort of see as struggling? And is there? I mean, obviously, there's no perfectly right answer, but perhaps as someone who has seen more people that are going through depression or something similar, maybe there's some
for sure
suggestions.
Yeah, and I think an empathetic approach tends to be a good approach. I mean, you'd want to let the person know that, hey, I care about you, and I've noticed a change, and I was hoping that we could maybe talk about it. I'm concerned, and I was hoping maybe we could talk about if there's anything going on, right? And really just come from a place of concern and empathy, and try to open up the conversation that way. And if you have a good relationship with that person, and you're there sincerely to listen, and you're there sincerely to help. I mean, if someone's struggling, I mean, generally speaking, they'll appreciate having someone who's there to listen and who's there to help and try to be supportive. So that's typically my approach.
Great. And just sort of another question that's sort of tied into this, but any thoughts on the rise in substance abuse and the impact on that? I don't know if you deal with that at all in your practice.
I do a lot. I can certainly speak to that. I think there's, a big factor is, a socio-demographic and socioeconomic factor where you have an increasingly growing vulnerable population, and you have a drug supply that's become more available for this vulnerable population, and you have people that want a vulnerable population to engage in using these substances. And so, no doubt, mental health, tends to be weaved within the issue of addiction and substance use. I mean, often people use substances to feel different, or to have a certain experience that they're not getting from their everyday life. And um, you know, things like poverty, things like trauma, things like um, domestic violence, abuse, depression, struggles. They can be factors that lead people to use substances, and then again, combined with easy access in social circles and elsewhere, it it feeds this vicious cycle. It's certainly a real issue in our community. Um, I'm generally an optimistic person on things, but unfortunately, I don't think this issue is going to get better anytime soon. Yeah, so that's just a brief, my brief view on the substance use and its relationship to mental health conditions.
Right. I think you hit the nail on the head. It's not going to get better anytime soon.
But please do encourage anyone that may be having issues with substances. There's help available. The RAM clinic. I run a walk-in clinic in town. You can talk to your doctor. There's lots of resources available, and there's a lot of clinicians that are sincere about helping people that might be struggling with these issues.
Right. So another question from an attendee, actually related to seasonal affective disorder. So would you say seasonal affective disorder is the most common type of depression in your office? I feel like lots of people talk about it in conversation, but not a lot of people seek help.
Yeah, so I can say that seasonal affective disorder is very common, and I definitely see a lot of it. I do see a lot of non-seasonal depression as well, and I would have to say that the non-seasonal variety is probably more common, but I always ask about the seasonal component. It's interesting in people with bipolar disorder, they tend to be very seasonally affected. Very classic depressive symptoms in the fall and manic symptoms in the springtime. And the evidence shows that bright lights are even more effective for patients with bipolar type depression and bipolar seasonal affective disorder than the typical seasonal depression or typical seasonal affective disorder. So bottom line, seasonal affective disorder, super common. And again, like, I think a lot of people take the symptoms for granted, right? Like, they just think, oh yeah, it's the winter, I'm just feeling blah, I'm feeling lethargic, I'm feeling tired, I'm just I'm just gonna putter through, right? And then some people don't realize that, hey, I mean, I'm not myself during the winter, and there's ways to improve. And I mentioned the bright lights, and one of the things I do every year is, it's for the last 2 years anyway, and I'm hoping to continue, is I donate 100 of the bright light lamps to the CMHA, the local mental health association, and just have them give them out to people who might need them and maybe can't afford them. I think they run as low as like $50, but they have a really profound benefit for people who might be having seasonal mood symptoms. So bottom line, if someone is having seasonal mood symptoms, I mean, there's ways to make them feel better, and certainly reach out and talk to your doctor.
That's really interesting. That's, I mean, obviously we'd heard about the bright light therapy, just anecdotally, but obviously you're a big proponent of it, and commend you for donating the bright lights to the CMHA.
Yeah, it's a really simple intervention, right? I mean, like, everybody eats breakfast. Most people eat breakfast in the morning, put the bright light on when you're eating your breakfast in the morning, right? It's that easy,
Right.
Yeah. So.
No, it's very interesting. It's definitely something to be mindful of. Okay. Were there any other questions for Dr. Nucci?
Gavin, I might have a question for Dr. Nucci, if it's okay. Dr. Nucci, you mentioned about mindfulness and how to, the sort of practice of our ability to have the emotional intelligence to kind of watch ourselves or watch what we're doing. I wonder if you might be able to speak to sort of the importance of self-talk and the language that people might use when they're trying to go through those observations, and what kind of role that might play.
Absolutely. And so you want to take the approach of being a non-judgmental observer, and you want to have the approach of accepting and letting be whatever comes up into the conscious experience. And again, at first it may be difficult, right? Someone's normal habits of being might be negative self-talk, right? And through the process of practicing mindfulness, you may discover that, hey, I'm a negative self-talker. And you can observe those negative automatic reactions, negative self-talk, for example, and you can say, hey, I had this automatic thought, this automatic negative self-talk. I'm going to replace that with a positive one, one of encouragement, one of self-love, one of support, one of optimism, one of positivity, and so very important to reinforce positive self-talk, for sure.
Thank you.
Thank you. Were there any other questions for Dr. Nucci? If not, listen, I'd like to thank you very much, Dr. Nucci. That was a really well done presentation. I mean, I could listen to you talk about the topic for another hour. It's obviously a very big issue, and it's tough to sum it up in a presentation, but I think you did a very good job of presenting it tonight. So thank you. And I don't know if there's anything else you wanted to just sort of leave off the attendees with, and sort of before you go.
No, I again, I thank you very much for the invitation to speak. I'm happy that it sounds like there was some useful information that I was able to provide, which is always great from my standpoint. Thank you, Gavin, again for your kind words, and I appreciate having the opportunity tonight. So thank you very much again.
And Dr. Nucci, let me echo Gavin's words as well. We certainly appreciate you taking the time to speak with us tonight, and for your support of Northern Hearts as well. It was very, very insightful, and I'm sure the participants are going to benefit from the entire presentation, and you can see possibly from some of the comments coming in that they found it very informative as well. Thank you again.
Great. Northern Hearts is a wonderful organization, and I applaud you guys for continuing to do the community outreach that you do. So thank you guys too.
Thank you. And one last plug for the Walk with Doc coming up in June here. an opportunity to get outside, get some sun, and get some exercise, as Dr. Nucci has clearly indicated is very important for mental health and physiological health. So thank you everybody for attending, and thank you again, Dr. Nucci. You'll have to just end the webinar on your end there, Dr. Nucci.
Okay. All right. Thank you. Take care.
Take care.
Have a great day.